The power of our voices is the essence of the new Her Voice Fund strategy, ensuring that the realities and needs of adolescent girls and young women inform and influence decisions that affect our lives. The new Her Voice Fund strategy will contribute to changing the narrative on HIV, health, and human rights issues that impact us on a daily basis. To reduce HIV incidents, we also need to work towards achieving gender equality, we need to address intersectionality, and we need to combat harmful gender norms. The leadership of adolescent girls and young women must be at the forefront of these efforts. No one is more invested, more committed, and more knowledgeable about how these issues impact us than adolescent girls and young women in all our diversity. The Her Voice Fund Strategy 2022-2025 aligns with Y Plus Global Strategy, which unifies us to raise our voices that will strengthen the equity and effectiveness of laws, policies, and practices, voices that will ensure programs and interventions address our priorities and have greater, impactful voices that will hold everyone accountable. With the 4 pillars focused on grant making, organizational strengthening, advocacy, and leadership development, Her Voice Fund strategy will provide us with critical investments. The Her Voice Fund strategy promotes meaningful engagement of adolescent girls and young women in key decision-making platforms and processes at local and national levels, including participation in country coordinating mechanisms and technical working groups, and review the development of national strategic plans. It also contributes to movement building and new leadership related to HIV, sexual and reproductive health, and the rights and gender equality and violence against women and girls. For Her Voice Fund to succeed and realize the greatest impact possible, we need a collective commitment from grantees and ambassadors to donors, technical partners, and governments. With almost 3 years of implementing the Her Voice Fund, we have substantial evidence that engaging adolescent girls and young women delivers results. However, we need to do much more. We need greater urgency in addressing structural barriers. We need interventions that mitigate the impact of COVID-19 related to global guidance and best practice. We need to ensure innovations and new technologies are accessible at scale. We now have a strategy. It is time for action. We are looking forward to launching our strategy on the 25th of January 2022, and we welcome all of you to join us.
Thank you so much for those welcome remarks, Cynthia. That was amazing. As we've already mentioned, our session today is going to take a deep dive into what engagement or meaningful engagement of adolescent girls and young women look like. I am joined by an amazing panel, and I'm going to introduce them to you now. First on our panel, we have a Her Voice Fund recipient from Lesotho, Mpho Masimong. Next on our panel, we've got Director of the Desmond Tutu HIV Center, Professor Linda Gail Becker, also known as Professor LGB. Our next panelist is Koketso Rathumbu, National AGY Ambassador from the South African National AIDS Council. Our panel also includes Executive Director of the Global Fund, Peter Sands. And last but not least on our panel, we have Kathy Feria, Head of Positive Action at Viv Healthcare. Join me in welcoming our amazing panel with a round of applause wherever you are. We're going to go straight into the discussion. It's going to be really fun. I hope that all of us are paying attention to this. It's going to be a mind-blowing one. My first question will go to Mpho. And Mpho, we would like to know that as a Her Voice Fund recipient, may you please share how the support you've received from the fund has further advanced you in just raising and amplifying your voice or the voices of adolescent girls and young women in Lesotho?
Thank you so much, Olorata, for the question. I confidently speak to you today as I am privileged to be among 3,006 adolescent girls and young women that her voice fund has impacted directly, and I'm able to advocate for the key issues that are affecting them. I am assertive, I am trained to advocate, and also I'm in the process of redefining what society has defined a young woman to be. The Her Voice Fund is a very unique funding process which puts adolescent girls and young women at the center of programming. Also, through She Hive Association, which is an implementing partner in Lesotho, we have had capacity building and empowerment sessions for adolescent girls and young women. These capacity buildings were made so that adolescent girls and young women are trained on advocacy so that they can stand up and voice out the issues that are affecting them. I've also had an opportunity to represent adolescent girls and young women in a SADC parliamentary forum where we were countering the domestic violence bill, and I highlighted the issue of child-headed families being unjust towards the adolescent girls and young women, for they assume their responsibility of being parents at a very tender age, and that becomes very draining to them emotionally, and it means that they cannot have the time to actually go out and participate meaningfully at spaces that are there. Lastly, I lead a She Hive Youth Club, which is supported by Her Voice Fund, where we create safe spaces for adolescent girls and young women and actually talk about our grievances and these issues that are affecting us, so that at the end of the day, we inform the policymakers to actually look at them and actually make policies that are going to serve us as adolescent girls and young women. The club currently has about 150 adolescent girls and young women, and through this capacity buildings that Her Voice Fund has been supporting, we have become really empowered. Thank you.
Wow, Mpho, that is amazing. Mpho is assertive, she's ready, she's a leader, she knows what she wants out of this, and she is just ready to redefine how society has sort of named or termed adolescent girls and young women. Thank you so much for that, Mpho. So Professor Linda Gale, both HIV and COVID-19 have highlighted the need for just to address inequalities, vulnerability, and disproportionate impact caused by these epidemics in the lives of girls and women. Why is it important for us to engage adolescent girls and young women in the HIV and now COVID response?
Thanks, Olorata. I think that's an excellent question. And let me start by saying we know that there are behavioral, biological, societal, and structural factors that lead to the disproportionate burden of HIV disease in young women and girls. Some of these factors have been further exacerbated, we know, during COVID-19. In particular, poverty, lack of education, unemployment, and power inequality, which leads to a further worsening of HIV and poorer sexual reproductive health outcomes in young women and girls. Increased orphanhood, especially maternal orphans, and particularly those who are girl children, we know also are at increased risk. These syndemics and factors are interconnected and complex. Solutions aren't clear, nor are they simple. They will similarly need behavioral, structural, and societal-based interventions to solve. For this, we need the input and the engagement of young women and girls to guide right from the planning phases all through the execution, the evaluation, and the eventual scale-up. Without this, we will fail. Where programs have engaged communities most affected, outcomes have been more successful and better sustained. The solutions are likely to involve the young people themselves, which in itself is positive. So without doubt, we need to have young people there about themselves and with themselves in the solution.
Thank you so much, Professor LGB. We need young people to drive these solutions forward. My next question for you is this. So we've now seen quite a lot of technology that promotes choice, autonomy, and focuses on peer-led approaches for HIV prevention. How can we better advocate as adolescent girls and young women for the drastic scale-up, accessibility, and availability of these innovations?
Thanks, Olorata. I love that question. I think it's an incredibly exciting time. This has been dubbed the prevention revolution, and I think it really is that. But whilst innovation and convenience, tailoring and choice all increase the likelihood that these tools will be used, there is still the element of behavior, right? Without acceptance, uptake, and utilization, these innovations are simply useless. New innovation on the shelf collecting dust is of no use to anyone. We need the voice and involvement of young people to ensure that we design, test, packet, and market these tools in the best way, and then distribute and create demand in also an optimized way. Young people are key to getting all of this right. We need to create the seats at the table, then ensure full engagement and participation. We need young people to rise up like their parents did for access to ensure equitable and timely access to these innovations. In short, we need a fresh crop of advocates and activists. The call is open and there is much work to be done. We are ready to pass the baton on.
Thank you so much, Professor Linda Gale. Those are such amazing words. I love how you mentioned the prevention revolution lying in the hands of this fresh crop of activists and advocates, obviously our adolescent girls and young women. Thank you so much for your contributions to this discussion. My next question is for you, Koketso. As the National AGYW Ambassador, you obviously have been involved in different kinds of processes or national processes in the HIV response in South Africa. May you please share how meaningfully engaging adolescent girls and young women has contributed to greater impact of the programs?
Thank you so much, Olorata, for that question. I think I'd start by saying that, to tell the truth, we are not there yet. We are not there yet. We are in the process of strengthening our meaningful engagement of young people. But I think maybe I can paint a picture for you in terms of what meaningful youth engagement looks like. So meaningful youth participation speaks to seeing young people as equal partners and contributors in the designing, the planning, and implementation of programs. Just to refer to the previous National Youth HIV Prevention Campaign in South Africa, which was called She Conquers, there's an evaluation report that came out that identified the importance of ensuring that young people lead and champion HIV prevention interventions. And as a key outcome, the report also alluded to ensuring that we address young people holistically and not in a fragmented manner, given that young people exist within the same community and the same society and interact with one another. And a deliberate example would then be to speak specifically to AGYW, which is of course informed by data, but this also then alienates the adolescent boys and young men, the young people already living with HIV, and we need to then re-evaluate our thinking to start seeing treatment as prevention as well, and to also include other sectors within the young people constituents, which are young people who are living with disabilities, the LGBTQIA young people, ensuring that no young person is left behind. And also some of the key issues that were raised by young people in the Global Fund RFF youth consultation process were issues of discrimination in health facilities specific to young people belonging to the LGBTQIA+ community, as well as those that are living with disabilities when accessing SRH services. And the lack of proper and ongoing sensitization for healthcare workers is also a barrier, and young people in this cohort indicated that ongoing meaningful involvement of young people will help identify some of these challenges and help to come up with key interventions to ensure that all young people, their needs are adequately addressed. Thank you, Susan.
Wow, thank you so much for sharing that, Koketo. Koketo started by just letting us know that we're not there yet, and she led us into how to get there. There's absolutely no way that we can move forward if we choose to leave young people behind. We need to address things holistically and ensure that they are right in the forefront of change. Thank you so much for that, Koketo. Peter, I'm going to rope you into the conversation now, and I'd just like to know, we understand that the Global Fund is in the process of developing its 2023 and 2028 strategy. And the strategy seeks to put communities first. We're leaving no one behind. Given the fact that adolescent girls and young women face greater risk of HIV acquisition, what role would you like to see the Her Voice Fund and adolescent girls and young women globally or generally play in reducing HIV incidence, in contributing to the new Global Fund strategy and the recently launched UNAIDS strategy?
Thank you, Oloretta. And building on Koketo's remarks, I think we've made progress, but we're not there yet. And indeed, during COVID-19, we've actually seen some pretty alarming reverses, both in terms of HIV prevention generally, and specifically to the position, to the risks threatening adolescent girls and young women in many parts of the world. And that, I think, underscores the importance of building on what we've done, but not being satisfied with where we are. And that's very much the spirit of the new Global Fund strategy, which the board has now approved, which, as you say, puts affected communities at the center. And that includes one of the most affected communities, one of the most at-risk communities, which is adolescent girls and young women. And there we are completely aligned with UNAIDS on the importance of it. What we have done thus far is to significantly increase the investments directed at prevention, testing, and treatment for adolescent girls and young women in the countries where they are most at risk. In the 2018 to 2020 implementation period, our investments basically doubled. And in the one that's just started in 21, they're significantly increasing again. But money alone isn't enough. To really have impact, to maximize the benefit of that money, we need to ensure that the interventions are shaped by, designed by, driven by the people who are affected themselves. And that, in this case, is adolescent girls and young women. And that's the power and the critical role I think the Her Voice Fund plays, because it is all about enabling the meaningful engagement of young women in shaping and making decisions on the programs that are affecting their lives. I think it was a fantastic initiative to start, and we're hugely appreciative of the partnership we have with Viv Healthcare and Y+. I think we need to build on this, and I think we need to ensure that the voice, the meaningful engagement of young women is embedded at multiple layers. At this point, Her Voice ambassadors are represented, I think, in 7 different CCMs. That's part of the Community Rights and Gender Advisory Group for the Global Fund. And they're actually also sitting on my Global Fund Youth Council. But I would completely agree with Koketo in that I don't think we're there yet. We need to find even more effective ways of ensuring that we empower women like Info with the tools, the information, the ability, the space at the table to shape those interventions. Dollars are going to be constrained. We're never going to have enough. So we absolutely have to ensure they have maximum impact. And the way of doing that is to ensure that those who are most affected have a critical say in how those dollars are invested.
Thank you so much for sharing that with us, Peter. And just the emphasis that money alone is not enough. We are so grateful for the investments that have multiplied, but we also know that you acknowledge the need to include adolescent girls and young women to maximize impact. The New Her Voice Fund strategy, as we heard from the teaser, highlights the importance of funding capacity and movement building. Kathy, please could you share your views on the importance of capacity building and strategic multi-sectoral partnerships to strengthen the leadership of adolescent girls and young women?
Yes, of course. Thank you very much for the question. So I think if we're really serious about meaningful engagement and leadership of adolescent girls and young women, then we really need to invest in them and provide them with the resources that they need to support one another. And that's why it's so important for this network to thrive and develop. And in order for these very impressive young women that we see to claim their spaces, get the right representation on the key decision-making bodies, and to be able to speak up with the kind of confidence that we heard from Mapu there, and without fear, they need to work together. They need to have the necessary trainings, the workshops, and be able to support each other as a movement. So they're empowered and even emboldened. We know, as Peter mentioned, some of the challenges facing adolescent girls and young women have worsened given the issues that we've faced with COVID-19. So we know adolescent girls and young women face greater risk of HIV acquisition, but gender inequalities, increased sexual violence, disparities and vulnerabilities really make them an important group that we really must support and help and make them a key priority. And we really need to support them to play a critical role in the HIV response. It's important for us all to work together on this. It isn't, as Peter said, it's not all about dollars. We need to work in partnership to ensure that we're ensuring what resources we do have, and we know that those resources are strained. We need to make sure those resources are going where they're going to have the greatest impact. And so partnering with the Global Fund and others and community organisations on the ground that are community-led, that allows us to be confident that we are getting the support and the resources to where they're most needed and where, importantly, they can make the biggest difference. We've been very proud to partner with the Global Fund on Her Voice, and we have a common interest in addressing the health development issues faced by adolescent girls and young women, and particularly in addressing capacity development. We know we need to tackle stigma and discrimination, but the most important thing about the Her Voice Fund for me is that we are getting meaningful participation in key decision-making forums. We know there's an awful lot more work to do, as you've heard, and as I say, we're really keen to partner well and to make sure that we continue to invest in these young women.
Not to put you on the spot, Kathy, but we know that you are a fan and a great supporter of the Her Voice Fund. Please let us know why it's so important to Viv Healthcare Positive Action and to you personally to fund the Her Voice Fund. Great,
thank you. I think addressing the epidemic amongst adolescent girls and young women is a key objective of Positive Action, and it's very clearly outlined in our Positive Action 2020-2030 strategy. It's a priority for ViV Healthcare to ensure that no person living with HIV is left behind. For Positive Action, we are really committed to drive community-led responses to HIV and really empower young women and their communities to tackle the HIV epidemic. And we believe that these young women have a vital role to play in driving and shaping the HIV response. Positive Action believes that the goal of an AIDS-free generation will be just impossible to achieve if women and girls are not a central focus of all our efforts in the HIV response. To the second part of your question, for me personally, I'm a passionate supporter of women's rights, and over the last 10 years, I've had the privilege really of working closely with young people living with HIV in sub-Saharan Africa. And as we've heard, women and girls face disproportionate risks of acquiring HIV, but they face many other inequalities too, all over the world. And we've seen women and girls being denied basic human rights, the right to feel safe where you live, to protection from violence, to fair pay, to be able to take control of our own bodies, our reproductive health. So that's why HIV is one of the many vulnerabilities facing young women. And for me, building their capacity, investing in them, getting their voice heard, empowering them is so important. And that's why this Her Voice program means so much to me personally.
Not to put you on the spot, Peter, but we know that through your personal and organizational commitment, you are just really care about advancing gender equality and reducing gender-related barriers to services. How can innovative partnerships and flagship initiatives like the Her Voice Fund best contribute to this?
Well, to start with, we're not going to beat HIV/AIDS unless we tackle the gender inequalities that, as Kathy says, hold adolescent girls and young women back in so many parts of the world. And we're not going to beat HIV/AIDS unless we take action to address the gender-related barriers to accessing health services. It simply won't work. So if we're going to do that, we have to have the kind of innovative partnership that Her Voice Fund is a great example of. And we need to give and empower adolescent girls and young women with the ability to lead, to make decisions, to shape the way things happen. And I think what we have already seen with Her Voice Fund is compelling proof that actually with relatively small amounts of money, we can achieve a lot of difference. Already the success, the learnings from Her Voice Fund have inspired other partnerships. An example would be Voix Essentielles, which is a fund implemented by Speak Up Africa and our partner Fondation Chanel, which is designed to do a similar thing, to drive the meaningful engagement of women and girls in Francophone Africa, starting in Burkina Faso, Côte d'Ivoire, and Senegal. And like Her Voice Fund, Voix Essentielles works very closely with the Global Fund. And we see these sorts of creative, innovative partnerships that draw on the energy and dynamism of young people themselves as crucial to delivering impact, to reducing incidence, and ultimately to defeating HIV/AIDS.
Great. Thank you so much for that, Peter. The emphasis on how creative and innovative partnerships fueled by the dynamism of young people will reach us to ending AIDS. Quite meaningful words. Thank you so much, Peter. Mpho, earlier you mentioned the amazing work that you are doing through the Her Voice Fund as a recipient and also just as reaching out a hand to other young people. May you please just share with us what you believe some of the biggest barriers or challenges to meaningful engagement of adolescent girls and young women in Lesotho is, and how the Her Voice Fund can support this or help overcome this challenge?
Thank you so much, Lerato. To start with, the biggest barriers that hinder us to meaningful engagement. In my country, we are a very patriarchal society, and that in its own makes the entire country to not recognize our expertise, and there's a lot of gender stereotypes for our skills and potential are undermined as opposed to our male counterparts. We are tokenistically involved in decision-making platforms or not given a chance at all. Also, we find out that spaces of empowerment are limited to urban areas, meaning that we're leaving behind those adolescent girls and young women that are in places that are hard to reach. And lastly, we are not empowered, meaning that we end up losing self-esteem when we're given a platform to actually engage with senior people or people that implement the policies. Lastly, we lack financial support to actually capacitate our advocacy campaigns. So the Her Voice Fund can support us further by giving or allocating a longer time frame for the existing capacity buildings so that adolescent girls and young women adopt and adapt the concept of advocacy so that at the end of the day, they're actually able to sustain their advocacy campaigns. It can also support us by funding us with more resources to actually go and reach adolescent girls and young women that are in remote areas. So it can actually broaden the platform to areas that are far. Lastly, the Her Voice Fund can increase the number of countries that are receiving Her Voice grant so that adolescent girls and young women everywhere in the world are empowered and they can be able to advocate for themselves and others as well. Thank you.
Thank you so much, Mpho. Earlier, Peter mentioned that the money alone is not enough, the investment alone is not enough, and that we need to maximize our impact by including young people in these interventions and in these innovations that we work out. And I'm so glad that Mpho has highlighted them quite explicitly. We need longer timelines for program implementation and sustainability. We need to be able to also just increase investment so that it goes beyond the urban areas where usually there's a lot more empowerment activities because they're easier to reach. And also just moving forward by saying she would love to see the Her Voice Fund expand into other countries so that other adolescent girls and young women feel the same way that she does, the empowerment, the advocacy, and just the leadership potential that our young people have. Koketso, what do you believe needs to happen for our voices, our realities, our experiences, and our needs to be better heard and acted upon in decision-making platforms?
Thank you so much, Olerato, for that question. And I think I'm particularly excited to really hear Kathy speak so boldly about capacity building, because I think that is a good starting point. So young people need to be given more than a platform or a role to merely endorse processes, but rather a well-capacitated voice to ensure meaningful and informed contributions into processes. So capacity building, with that said, just tying it back to Kathy's input, is one of the fundamental foundations which governments and partners should really focus on. This would be through capacity building workshops, ensuring that young people know how to comply and be able to apply, for example, to be sub-recipients of funding and grants, to actually be part of the implementation process itself, and ensuring that young people who sit in these decision-making platforms understand policies and how they are impacted by these policies, and possibly be able to develop a youth-designed and led accountability framework which will assist us in measuring progress and all the key interventions. Because one of the key challenges that young people keep alluding to is that young people themselves are not able to measure and not be able to hold processes accountable. So it would be important that we capacitate those young people to be able to understand, to be able to have the ability to create these tools and be able to participate meaningfully in those processes. And also this will ensure that young people are aligned with the global and national goals, such as the Sustainable Development Goals, such as the Global AIDS Strategy, which was referred to earlier, the national strategic plans in countries for HIV, TB, and STIs, malaria, and you name it, as well as strategies focused on GBV and youth health policies, which aim to reduce HIV infection significantly among adolescent girls and young women and other youth groups, and also to ensure that those young people who are already infected with HIV reach the 90-90-90, which we are all hoping that we reach. And in fact, linking back to the global AIDS strategy, we are able to ensure that we eliminate AIDS as a public health threat by the year 2030. Thanks, Lafat.
This brings us to the end of our amazing discussion. I know we all would have wanted more. It was such a rich, informative, very fun conversation that we had with our amazing panelists. I just want to wrap it up with this. Some of the things that were mentioned in the conversation that came up or were echoed as the different speakers were given their contributions. The first one is there's absolutely no way that we can leave adolescent girls and young women behind in the response to HIV and now COVID-19. The second is that capacity building is critical. There's absolutely no way that we can empower, we can support without ensuring that intentional investments are made in the lives of adolescent girls and young women. We are so grateful that the Her Voice Fund fills this gap, and through the support of the Global Fund, Viv Healthcare Positive Action, and the many adolescent girls and young women who take part in this initiative, we know that things will look better for us. Thank you so much for listening to this discussion. We hope that you learned something. We hope that it sparked something, and that as you go home today, you are also just ignited somewhere in your heart to better amplify the voices of the adolescent girls and young women in your community.